You're ready for the day ahead by bringing you information you need to know in the fight against coronavirus.
And today we'll get an idea of how well the state is handling the economic impact. UNC Charlotte economist John Connaughton will present his quarterly forecast, and it'll be unlike any other in recent years. He is expected to address how long it'll take the state's economy to get back to 2019 levels and walk through scenarios for the rest of the year. Now, last week he estimated the state's real unemployment rate at 20%, higher than the 14% released by the Department of Labor.
Well, this morning we know more about graduation plans for seniors in Rock Hill. Open air graduation ceremonies, they're scheduled for June 5th and 6th. Everyone who attends will have to wear a mask. They also need to maintain social distance. Graduates will have their temperatures taken before receiving diplomas. Each will be given color-coded tickets that will assign seating and parking.
And North Carolina lawmakers are considering a bill that would protect child care workers during the pandemic. House Bill 1117 would provide more than $120 million in relief funds. Now, here's how all that breaks down. Okay, the biggest chunk, $100 million, would go toward increased bonuses for child care teachers and staff. $15 million would be used for cleaning supplies and personal protective equipment, and $500,000 to cover out-of-pocket costs, including the copays and deductibles, and nearly $6 million to hire more child care health consultants. The bill passed its first reading, and it's now going through appropriations before moving on. Now, as child care centers reopen, many have new procedures to make sure that kids stay healthy.
As you can imagine, those precautions are not cheap. They're not foolproof, and that has some parents worried. Reporter Anthony Castura is live for us in East Charlotte this morning with the alternatives that some are considering.
And John, as you mentioned, some child care centers, including Smart Kids Child Development Center here along East W.T. Harris, have reopened, but other centers are still closed. And the state is concerned COVID-19 could rattle this industry, leaving parents with fewer options. As child care centers begin to reopen, helping parents with the great balancing act of COVID-19, managing work, kids, and a global pandemic, some say the relief is short-lived. Those centers are required to follow a series of guidelines, including temperature checks and maintaining social distance. But for parents like Carrie Davis, it's just not enough to keep kids safe.
That doesn't really help us when it comes to childcare.
Davis and her husband both transitioned to work from home while simultaneously caring for their 3 kids, all under the age of 3. When their daycare center closed, they opted for a nanny.
Right now, it's just our immediate family and our current nanny. We felt like by having in-home care, we've mitigated a lot of risks.
The option could become more popular in the months ahead. Right now, the state's Child Care Services Association predicts 44% of child care services could close permanently in North Carolina because of the financial loss from COVID-19. That could result in losing nearly 144,000 child care spots across the state, according to the Center for American Progress. Emily Miller founded her company, Charlotte's Best Nanny Agency. This is her team for a CPR training pre-COVID, and says they're seeing a 30% jump in calls. She placed the nanny the Davises are using right now.
Some daycare facilities haven't been open, some are not at full capacity, some summer camps aren't open, some families are just not comfortable sending their kids into a group situation right now.
This has really given me a sense of control over where our family's journey is going and how we're going to not only protect ourselves, but our little community.
And Carrie Davis there says the cost of a nanny compared to sending her 3 kids to a daycare facility is about the same when you break it down by hour. It is just one more option to consider as parents head back to work. Yeah. Back to you.
You know, a lot of parents are trying to figure all of this out over the summer. Anthony, thank you.
Well, the state pushed back opening bars and gyms because data like daily cases and hospitalizations, they were not trending down. And now hospitalizations have actually spiked again. 702 COVID-19 patients are in the hospital. That is compared to 621 yesterday. And look at the yellow line there. This tracks the 7-day average of hospitalizations, and it's actually been climbing for 2 straight weeks now. The state wants to see that trend down or level off for 2 weeks before we can move into phase 3. All right, let's look at the cases here. The state reported 488 new cases yesterday out of nearly 12,000 tests. So only about 4% of those tests are actually coming back positive. In South Carolina, the percentage of positive cases jumped from 4% to more than 7%. There were more than 200 new cases. The state also reported 20 new deaths yesterday.
Well, businesses are now drawing a line in the sand, and they're taking a stand against Governor Cooper over who can reopen during phase 2.
And we know churches have already been successful in securing a temporary restraining order. Well, now bars, gyms, even strip clubs, they want the same. Reporter Gina Esposito is live for us in South End this morning with the challenges they face making their arguments in court. Gina?
Yeah, the owner here of High Fitness in Lower South End says that he's frustrated they were left out of phase 2, so he defied Governor Cooper's order and reopened on his own. You can see they opened just a couple minutes ago. There's people now inside working out. There are other businesses across the state fighting the governor's order too. We told you yesterday, owners of a chain of gyms filed a lawsuit arguing their forced closure is preventing them from serving people with medical conditions. They also claim their forced closure is a violation of the state constitution. The owner of High Fitness agrees things are unfair.
And at this point, it just feels arbitrary for some other stuff to be open and us not be included in that.
Churches successfully received a temporary restraining order allowing them to resume indoor services, and that's why other businesses like gyms, strip clubs, and a trampoline park are suing the governor. A federal judge already denied a temporary restraining order for strip clubs. An attorney says just because churches were successful doesn't mean gyms and trampoline parks will be.
Your right to go to a trampoline park is not specifically written into the Constitution the way your right to worship is. That's going to be a big issue.
Now, this week, a letter was also sent to Governor Cooper on behalf of bowling alleys, threatening legal action if those businesses aren't allowed to reopen soon. We'll let you know how these lawsuits pan out. Back to you.
Yeah, it'll be interesting to see where we go from here. Gina Esposito live for us this morning. Thank you.
Well, no doubt you've heard about mask shaming, people who do wear masks mocking or shaming others who don't. Well, Channel 9 spoke with a psychiatrist from Atrium Health who said for a lot of reasons, it's not a good idea.
Somebody may not be wearing a mask, and there may be a variety of reasons why they're not wearing a mask. And it may not be because they don't care about your health, but maybe it's hard for them to breathe through the mask. Maybe it's scaring their child, and so they have a child with them and they don't want to scare their child, so they're not wearing a mask. And maybe it's just that they don't understand or their feelings about COVID-19 are different than yours. So it's try to have that understanding of why people feel the way they do.